beliefs, and fears about their health, and one of the most widespread areas of confusion is the idea of regular health checkups. Misconceptions circulate among seniors, families, and even young members, shaping decisions in ways that affect quality of life, longevity, and emotional well-being. When we talk about health checkups, some elderly individuals shrug it off with statements like, "I'm old for this now," or "What difference will it make at this age?" Yet preventive care and early diagnosis remain important at every stage of life, because aging does not mean giving up but rather requires smarter monitoring, since the body becomes more vulnerable to silent conditions like hypertension, diabetes, osteoporosis, kidney disease, and cancers that progress unnoticed. One of the greatest myths is that screenings are pointless after 70, while in truth, the necessity of each test depends not just on age but on lifestyle, family history, and overall health. So a 75-year-old who is active, eats well, and has controlled blood pressure may still benefit from screenings like bone density or cancer checks, while someone frail with multiple illnesses may need a more selective approach. But to assume age alone cancels the value of checkups is harmful. Another common fear is that visiting doctors automatically means being prescribed a pile of medicines, but modern medicine is moving toward rational prescriptions, lifestyle modification, physiotherapy, and nutrition, and checkups can actually reduce medicine load by identifying unnecessary drugs. There is also a widespread belief that memory loss, weak muscles, or fatigue are just natural signs of aging, but many such symptoms may be linked to treatable causes such as vitamin deficiencies, thyroid issues, or depression, which if detected early can be managed effectively to preserve independence. Another misconception is that if a person feels fine, they do not need a checkup, when in reality diseases like heart problems, kidney issues, or cancers often remain silent until advanced, which is why preventive blood tests, ECGs, and scans act as an early warning. Financial stress is also a reason why many seniors avoid checkups, thinking they are too costly or stressful, but today there are affordable senior-friendly packages, government programs, and simpler procedures that minimize strain and expense, making it practical too. Monitor health. Cultural beliefs also contribute, with some seniors saying that after 70 destiny should decide, but such fatalism ignores the joy and dignity that healthy aging provides, whether in spending time with grandchildren, traveling, or living pain-free, all of which require active health monitoring. Another myth is that talking about checkups increases anxiety, but in truth ignoring health does not remove problems, it only delays detection until they become harder to manage. Misinformation from peers often worsens things, with one senior discouraging another by saying tests weaken the body, but the reality is the opposite. Timely testing prevents weakness by detecting correctable conditions. Another wrong assumption is that modern medical technology is too harsh for the elderly, yet therapies and procedures are now tailored to be age-friendly and safe. A major misconception is that diet and exercise no longer matter after 70, yet doctors emphasize that even moderate walking, yoga, and balanced nutrition can strengthen the heart, improve bones, and boost mood at any age, especially when guided by checkup results. The idea of "I have lived enough, why bother" also causes emotional and family stress, because treatable illnesses, if ignored, can suddenly escalate into emergencies that could have been prevented. Society too often glorifies youth and sidelines the elderly, creating a belief that caring for health after 70 is not important. But awareness and education can change this culture by encouraging seniors to value proactive care. Medical science is not about prolonging life unnecessarily but about enhancing the quality of remaining years by reducing pain, maintaining memory, and supporting independence, and health checkups are the gateway to achieving these goals. Another dangerous assumption is that hospitals are only for emergencies, when in fact their preventive role is far greater, helping seniors stay out of emergencies by catching issues early. Some also believe that checkups always bring bad news, but often they bring reassurance when results show stability, giving peace of mind. Mental health is another neglected area. Many think depression, loneliness, or anxiety are just emotional weaknesses, but doctors stress that mental health checkups are vital because such issues can be linked to neurological conditions and weaken immunity if ignored. Women after 70 often assume they no longer need gynecological care, but Postmenopausal women remain at risk for cancers and bone issues. Men neglect prostate health checks. Though prostate conditions are common in this age group, another misconception is that pain and discomfort are unavoidable at this age, so no doctor can help. But modern medicine provides several safe interventions to improve mobility and digestion without over-medication. Cultural pride also leads some to avoid doctors, thinking admitting weakness is shameful, but in fact acknowledging health needs is wisdom, not weakness. Many avoid diagnostic tests fearing they are too weak for them, but modern tests like ECGs or scans are quick, non-invasive, and safe, posing far less risk than untreated disease. Diet misconceptions are strong too. Some indulge in unhealthy eating thinking discipline no longer matters, but evidence shows lifestyle corrections at any age make a big difference in energy and longevity. The excuse "my parents never had checkups and lived long" is also flawed, since lifestyle, diet, and environment have changed drastically, and what worked for older generations cannot be applied today. Another overlooked myth is that vaccines are only for children, while in reality, vaccines like flu shots or pneumonia vaccines are crucial for seniors. Embarrassment also prevents many from discussing issues like incontinence, hearing loss, or sexual health, but these are areas where checkups provide effective solutions to maintain dignity. Financial misconceptions also make families think spending on seniors' health is wasteful, but timely checkups prevent costly crises like strokes or fractures. Emotionally too, seniors sometimes fear that knowing about disease increases anxiety, but knowledge actually reduces uncertainty and gives practical solutions. Many think hospitals are unfriendly, but more centers now offer geriatric wards, senior desks, and packages that make the process smooth. Some feel checkups disturb their routine, but a few hours once a year saves months of suffering later. Others trust only home remedies or family advice, ignoring professional diagnosis. But while traditional care is supportive, it cannot replace accurate tests. Many seniors believe that once medicines start after 70, they cannot be stopped. But doctors frequently revise and reduce prescriptions at checkups, lowering the pill burden. Lastly, spiritual misconceptions make some think seeking medical help interferes with divine will, but most philosophies teach that caring for the body is a duty, and checkups honor life rather than deny mortality. Thus, health checkups after 70 should be seen not as a burden but as a path to living one's later years with dignity, independence, and joy, and every misconception that stands in the way must be replaced with facts, compassion, and encouragement so that aging becomes a phase of strength, wisdom, and renewed vitality. After